That breaking news will soon impact all Californians. This afternoon, the state announced an indoor mask mandate in all public places, regardless of vaccination status. The State Department of Public Health says the requirement starts this Wednesday and will last through January 15th. Officials say the new requirement is in response to a nearly 50% increase in COVID cases since January. And joining us now to discuss the new mask mandate is Sharp Reese-Steely Medical Group's family medicine physician, Dr. Abby Ulalade. Thank you for joining us this afternoon.
It's good to see you, Kimberly. Thanks for having me.
All right, indoors masks now as of Wednesday mandated. How effective really are masks inside?
So we actually have a lot of real world evidence to show that masks do work to limit the spread of COVID, especially because this is a virus that can be spread by people that don't have any symptoms, which is part of why it's extremely dangerous. So it's really like driving a car when you have many layers of protection. You have the seatbelt, you have the brakes, you have the airbags, not just one layer of protection. And all of those things become even more important when you're driving on a dangerous road. And we are in a dangerous path. So we know the vaccines do work, but we now need that additional level of protection, which is the mask.
What about outside? Just a perspective of observation. It seems like people feel pretty safe outside without a mask, but is there really things we ought to be thinking about and things we ought to be doing?
Well, it's just a bit complex because the virus has upped the ante, essentially, because it's now potentially more contagious. We've seen this new variant, and we know that the Delta variant is even more contagious than the original one. And so, yes, when you're outside, there is less likelihood of spreading COVID and getting COVID, but it's not impossible. So if you're someone who has those conditions that put you at risk of getting severely ill, you may want to take even those additional precautions even when you're outside, because it does happen, but there's a lower likelihood of that happening.
There's been a lot of conversation since the majority, way over half of us here in California are vaccinated. There's a lot of discussion now that with Omicron perhaps being something that you can catch a little more easily, but if you're vaccinated, people are kind of describing it as the common cold and saying, hey, if you're vaccinated, it's kind of like the common cold, as if don't be afraid of this thing anymore. What is your response to that?
I would say that, one of the biggest threats, that we have is really COVID fatigue and misinformation. We don't want to rest on our laurels. We don't want to take anything for granted, because it would be a mistake to assume that. We don't have enough data yet to confirm that. And what we have seen from the data is that this actually is a variant that has a much higher level and chance of people in a household have a much higher chance of infecting someone else in their household as compared with Delta, which is very concerning. And yes, what we're seeing is that the cases are mild, but we don't want to assume that. We just need to see what the evidence shows us. The other aspect of this that's concerning is that we have seen some preliminary data from Pfizer stating that the initial 2-dose vaccine regimen does not fully protect against infection from the variant. And so knowing that a booster may give you that full protection, the best protection at this point, there's only been 20% of people in San Diego County that have gotten boosted. So we don't want to take this for granted. Get vaccinated, get boosted, because the coronavirus is not taking a holiday.
Not taking a holiday. We'll end on that. Thank you, Dr. Ulalade, for your expertise this afternoon. We appreciate it.